Thanks for watching Mid-Morning this Tuesday. There's some major concern over COVID-19 variants that are causing new spikes in hospitalizations.
According to scientists, the strain first seen in the UK is doubling nearly every 10 days. Health officials worry it could become the dominant strain in just a few weeks. Heather, we've heard, this is always a challenging thing, right? Because we've heard concerns about health experts many times. And sometimes you look at the results and say, well, maybe the concerns caused people to behave differently, or maybe the concerns were overblown.
Right.
But we have some hard data on what's going on here, right?
Yeah, and it's hard to get this kind of data because we're not doing the kind of surveillance that they do, let's say, in the UK, where they were able to discover this strain first. But what they're saying right now is that UK strain that we keep hearing about, there's the South Africa one, the Brazil one, but it's really the UK one here. I think it's probably 1 to 2% of people in the country. But in certain areas of the country, say Florida, it could be as much as 4%. So if it is doubling every 10 days, that 2% then becomes 4%, becomes 8%, becomes 16%, and that's where you get that dominant strain because it's more contagious.
And that's another thing that we've been looking for information on, right? We had heard that it's more contagious, and you think, well, what does that mean exactly? And it does seem to be pretty significant, 30 to 40% more contagious. Not more deadly, but the issue of survivability is that if it's more contagious and more people get COVID, then you have those sorts of concerns.
Right. What was interesting about this is they were able to really dig deep on the kind of variant that it is. So the researchers found that this variant was introduced 8 separate times in between Thanksgiving and Christmas from people who were traveling between Britain and the United States. So is it more transmissible, or is it just more people are bringing it in different places?
Right.
That's a hard thing to figure out as well.
Exactly. It does make you wonder, why, not that you can close your borders and shut this stuff down, but it does make you wonder if, in retrospect, were we paying enough attention to this idea that there are going to be variants? They are likely going to start overseas because the virus has been around in some of those areas longer. And did we do enough to try to shut down travel?
And are we doing enough now
what Canada's
to
doing,
do
right?
surveillance of where they are? So in Minnesota, we're only testing about 90 cases. They're trying to get up to 150 cases a week that they're able to test. They say that's similar to like what you would test during the flu because they keep close tabs on flu surveillance. But there's a lot of people, a lot of national experts that are saying we need a national program to be able to test these strains to know what's actually changing because we're not getting people vaccinated quickly enough. We're not beating out those variants right now.
And the biggest fear, I guess, is that there are people who have already had COVID who feel like they're pretty much in the clear, right? But we don't really know. We don't really know if these variants, could reinfect people. And we are seeing sort of different results with different vaccines in attacking the variants. I mean, any vaccine is better than nothing, but that's why the rush is on, right?
And I'm hearing more of a discussion about perhaps a booster shot in the fall. And that you may be so it's going to be a while before we figure out just how often we need to be vaccinated for this thing. If you do need boosters, if you need it every year, and part of that is these variants.
Right. Yep. All right. Something else to watch and worry about, right? Just in time for Fit February, Wallet Hub is out with its list of healthiest and unhealthiest cities in America for 2021. In Minneapolis, which is about we're about the 43rd largest city in the country, comes in at number 15 on the healthy side, outperforming our size.
Good work, Minneapolis.
Healthiest city is San Francisco.
Yeah. You got a lot of San Francisco, Seattle, Portland, San Diego. Got a lot of West Coast.
So everybody's on the ocean. Why do you think San Francisco is the healthiest city?
What do you think, Bradley?
Well, it's hard to say because I feel, living in California for a long time, I would say Los Angeles, Orange County, San Diego, that kind of falls in that area. They're all healthy, but I think it's a different lifestyle, a way of eating. That's probably one thing. Better weather where you can get outdoors and do a lot more stuff year round versus, where we have it here. We have the hard winters. I mean, San Francisco, though, it's cooler. You get the fog up there. You get more sunshine down towards San Diego. Portland, for example, I lived in Portland, and they're health fanatics up there. They are. And since it's a rainy climate, though, and people still get out and they do it, and the gyms are always going. Now, was this taken obviously pre-COVID, most likely?
No, they do it every year.
They're not really using data on like what you're specifically doing.
Yeah.
They're using data that is available. So like the cost of a medical visit, the amount of mental health counselors per capita, the amount of running trails or walking trails per capita that they have.
Cost of a fitness club membership, those sorts of things. So it's more hard data they use, which, makes this sort of laughable, right? Like you either believe that their formula is a formula that gets you to an actual indicator of fitness or not.
Right.
St. Paul does much worse, 56th on the list.
Right.
And that's, to me, again, like that's sort of laughable because are you really going to convince me that it's that different in St. Paul versus Minneapolis?
That's surprising, really.
I mean, there are fewer trails, I suppose you could
We
look
do
at it
well
that way.
here in Minneapolis with green space, but we don't do great with fitness. I think it's also important to point out when we talk about these kinds of studies, there are a group of people that are doing very well, that are very healthy, and then there are other groups of people here where we see this wide gap when it comes to health incomes, health impacts, health outcomes. So I think that's always an important point to point out when we talk about these averages because they're quite wide.
Well, to Riley's point about the weather being a factor, I mean, so you do end up more inclined to buy a fitness club membership because you can't be necessarily, I mean, some people run outside in the winter, but most of us, it's going to be a hard pass on that. So it's expensive, right? I mean, that's a reality.